Let's start with acupuncture. What does the research say about acupuncture's effectiveness for migraine?
So I'm a licensed acupuncturist. I've been a licensed acupuncturist for about 30 years. Obviously, I believe that it does work. Now, we lack definitive proof like we have with medications, because with medicine, it's very easy to do a double-blind study, meaning you take a sugar pill or you take a real pill, and you really don't know what you're taking. And then you can show that real medicine works better than placebo. Very hard to do research in acupuncture. But people have tried all kinds of tricks to make people believe they're getting a needle stuck into them without doing it. So it's very hard to do these controlled experiments. But I think the proof comes from animal studies. And many veterinarians use acupuncture on animals. So clearly it's not just placebo, because many physicians are skeptical and say it's all placebo effect. Even if it is placebo effect, it's still worth trying, but I think it's definitely more than just placebo. And I tell people that about 60% of people tend to respond. That's approximate guess. And usually you don't have to go for a long time, because some acupuncturists will tell you have to come 10, 20 times before we know if it's going to help. I tell my patients that if you feel really relaxed and enjoy the experience, if you feel good doing acupuncture, that's a predictor that it probably will help you. It involves the release of endorphins. And again, the research showed that in animals, if you stimulate at a certain rate the acupuncture needles, you produce what's called endorphin-mediated analgesia. That is pain relief produced by your endogenous morphine system. And you can reverse that with naloxone, an antidote to opiates. And there is depending how you stimulate, if you stimulate at a high rate, then you have serotonin-mediated pain relief in animals. So the point is, when you have acupuncture and you feel very relaxed and happy, that means you have some release of endorphins, and chances are that will help you. But other people can't wait for the needles to come out. They feel uncomfortable. They don't feel anything. And they usually tell them after a couple of sessions, just give it up if it's really unpleasant. So that's a predictor whether you might be a responder or not.
Are there particular acupuncture points that are most beneficial in migraine?
Yes, but most acupuncturists will place many, many needles, at least 10, 20. But the typical spot is between your thumb and the index finger. And actually, there's a plastic device that you can put on and you press. And if you're having a headache, you can press on that very tender spot. There's a bundle of nerves here. It's called a Hoku point. And if you press, pain gets better, actually. Pain or dental pain or head pain. Unfortunately, just pressing it, it works while you're pressing, and then you let go, it may come back. But if you can just keep pressing, and if you buy that plastic device, it costs like $7 or something like that. And you can provide some relief, but acupuncture clearly is more effective. So these are two common points on the head, actually in the legs, for nausea, and sort of many, many acupuncture points.